So in the last hour or so, hour and a half, the governor did a couple of things. Sadly, they were suggestions and not actual mandates. But he said that everybody over 65 should stay indoors and basically self-isolate. Restaurants and bars should close. Restaurants should be at 50% capacity. And there was a third thing he said, but that wasn't important. The only sad thing is these were not mandates. These things really need to be a mandate. People, the mandate will happen. It's solely a matter of, are we going to do this 2 weeks from now when it gets horrible, or are we going to do it now? And, in Rome, we're at a similar point where Rome was about 15 days ago. Rome 15 days ago, they put in a mandate saying, hey, you guys shouldn't be out here congregating. You look at Twitter videos from that time, the fountains and the Spanish Steps are still like hugely populated. And then people started dying. Once people started dying, the people in Rome actually took the mandate seriously, and they stopped going out, and they put on masks, and they self-quarantined when they started seeing people dying. There's like stories of people who, I think this was the New York Times yesterday, someone in Rome who had their neighbor die, and the only reason they found out is because it started smelling. So we're going in that direction. So I want to talk about some things that sometimes it kills me to read Facebook, because I'm like, there are so many people saying stuff that is so fucking wrong, and I can't fucking stand it. Like, someone says, hey, 70% of people recover. I'm like, great, you never thought what happened to the other 30%? Italy has a death rate of 7%. It's like, great, 70% recover, 7% die. It doesn't mean that we should not do stuff, not care because 70% of the people recover. It just kills me knowing, hang on, my dog needs to go back inside. 70% recovering is a horrible rate. Horrible. 99.9% of influenza people recover. And, we still care about that 0.1% who dies. In Italy right now, they're having a death rate of 7%. That's an extremely high number, no matter what the denominator is. So I heard someone say, hey, people in China are getting better, so therefore we don't have to worry about it. Let me tell you what China did, and you could compare that to what we did here. So China at the start, they were horrible. They're like, okay, this doesn't exist. The doctor who was sounding the alarm, they basically jailed him. And, China does plenty of things wrong. Their response to the disease was spot on. And it always kills me when I see this online, people praise the response of China, and people's like, oh, really? Remember when the government killed that doctor? They tried to make it completely political. China did a great job, and here's what they did. One thing, China built more hospitals. China mobilized their entire economy to fight this virus. It's something we're not doing. They built two large hospitals. They brought doctors out of retirement. They taught nurses at the same time. But most importantly, what they did is they did mass restrictions on traveling. You are not allowed to be outside of your place. And they set up specific fever clinics. And this is ingenious, and this is what we will do 3 weeks from now when it gets bad, and it's what we should be doing now. They had a fever clinic where if you had a fever, you went to this clinic, and they would take you, they would check you for the flu, they would check you for the CBC, see if you have a bacterial infection, which is the easy blood count. And if you didn't have the flu, if you didn't have a bacterial blood count, but you showed the symptoms, they put you in a gym. So it doesn't matter how sick you were. If you had a fever and you fit these things, you were put in a gym with all the other cases. And they kept everybody in the gym. They did not send people home because they found out that if you went home and self-isolated, you infected every other person in your household. It was, if you live with someone who has this disease, you have this disease. And so that was the biggest thing that China did. If you had a fever, you had to go get checked. If you had it checked and you didn't have the flu or you didn't have a bacterial pneumonia, you were staying there for 14 days. You stayed in the gym. And they had that gym, they had the gyms that they built, and they had people checking, and if someone went downhill, then they were moved to the hospital. because of the fact they basically quarantined everybody who had a fever. That is how they stopped the spread. That is how come China in April, wait, what is March? It's March right now? Yeah, it's March. That's how China, 90 days after it started, was able to effectively stop the disease by basically stopping all travel. And if you were sick, you were stuck in the hospital for 14 days and you were not allowed to go home. We're doing none of that. We're doing what Italy did. Italy just said, hey guys, stay home. Don't go out. Don't talk to people. People still went to bars. People still went to picnics. People still went around. And that is just something that, cannot go on. That's what pissed me off so much about Newsom. It was like, hey Jack, I'm recording a live video, so I can't talk. That's something that killed me about Newsom. It wasn't a mandate that the bars close. The bars and restaurants need to close today. If you go out to a bar, you are drastically increasing the chances you'll get sick and other people will get sick. Restaurants, it's like, oh, social distancing. That's not going to happen. Like I see Facebook videos of some of my friends going out to clubs yesterday. I'm like, oh my fucking God. Like, I can't believe that our government is allowing these things to continue. I don't blame people who are not educated enough to know that, hey, this is a serious thing. And, 1918, a disease killed everybody. I blame our government for saying, hey, this is illegal. You need to shut it down. So what's happening in Europe right now is all of these countries that waited too long, they're doing what needs to be done. Spain is on lockdown. Italy is now in lockdown. In Italy, the main part that was affected is a bedroom community of Milan. These are rich people. And they had great health care. Someone said, oh, this is socialism. Like, that's what inspired me to start deleting people. There are some people who believe everything Fox News and Trump tells you, which is bullshit. But in Italy, it's a bedroom community. It's the equivalent of, do we have a bedroom community here? I mean, Beverly Hills, kind of. It's like Greenwich is to New York City. All these rich people go from Greenwich into New York City and back. So their equivalent of Italy is where the infection happened. There was a obituary from February 9th. They had 2 pages of obituaries. They had an obituary from last week. It was 8 pages of obituaries in their newspaper. Their death rate went up 4 times. 4 times in a rich place with great hospitals. So, there's all these Americans who say, oh, that's China. Oh, that's Italy. That can't happen here. Italy has a better healthcare system than us. We have a horrible healthcare system. Italy has like 2.3 ICU beds for 100,000 people. We have 1.8. They have a 30 to 40% better system than we do. This disease is doubling in the United States every 3 to 5 days. Every 3 to 5 days, the number of cases are doubling. And that's just the cases we catch. It's probably, it's similar. We probably have similar doubling out there. So, the U.S. says they have 3,000 cases. We probably have 50,000. We have a minimum of 20,000, but we probably have about 50 to somewhere above 50,000 cases of this disease across the United States. And it's in every community. It just so happens that now people are starting to get tested and, we're identifying them. It's not so much that they weren't there in the first place. It's that, hey, we finally have enough tests that we could actually figure out who it is. So, the goal of every disease is when it starts, you contain people. If one person is sick, you say, hey, that person is sick. We need to contain them. And we contain any person we touch. Because our pandemic response was fired 2 years ago by Trump, and because they didn't accept the World Health Organization test, and because the CDC screwed up their first test, we are about 2 months behind where we need to be. We don't have the tests to test everybody. California could test 7,000 people a day. We have about 5 million people over 65 years old. 7,000 to test. If we only said, okay, you only get tested if you're over 65, we could test 7,000 of those people a day. 7,000 of the 5 million people over 65. That is horribly bad. And, we need to be able to test like 50,000 people a day in California. And, who knows if we'll get there. I don't think we will for a while. So some of the things I did want to talk about is what these disease symptoms are. There are a couple of things that are very, very specific for this disease. Basically, if you have this disease, you will have this symptom, and that's fever. If you have fever, basically, if you don't have fever, you don't have this disease. If you have fever, you have the disease. It's also known as a dry cough, and you don't have a runny nose. So if you have a runny nose, you probably don't have a disease. Those are the three main things that I could tell you that differentiates this disease from all other disease. If you have a runny nose, you don't have it. If you don't have a fever, you probably don't have it. Now, it takes about 5 days before people are really sick. So you could have 5 days of having it before you get your first fever. But at some point in time, you will have the fever, and that fever is what has it. My mom right now, she's sick. She's not going to be able to go on a trip with us because she's sick, but she has a runny nose. So I'm like, okay, she probably has the flu. Now, I see a lot of people out there saying, hey, 80% of these diseases are mild and you won't notice it. That is completely wrong. Those numbers come from China. In China, we have 60,000 people, so there's a huge number of people they could test. They divided people into 3 categories. You had the very ill, the people who went into organ failure or some major thing like that, required ventilation. That was about 6% of the people. 15% of the people required hospitalization. Everybody else was considered mild. So if you didn't require hospitalization, you were mild. That doesn't mean you won't have the worst flu of your life. That doesn't mean that you'll have like super bad symptoms. You know, a lot of these young people in China, they had bad symptoms. Some of them were lucky and didn't, but a lot of them did. So, you know, I mean, just because you say, oh, 80% is mild. No, it's not 80% is mild. 80% didn't require hospitalization. And that's a big difference. You know, I mean, who knows? It could be that 25% is mild and 50% is worst flu of your life. So, you know, I mean, all these millennials and young people, you know, it's not going to be a walk in the park. You're going to feel this. So let's say you are sick. What do? One, you send away any old person that's around you. You do not touch them. You do not go near them, because if you're sick, it is such a highly contagious thing that there is such a good chance that you'll transmit it to someone who's older. And so, you know, the second you're sick, you know, there's a good chance that you've been infectious for 2 days before. So you need to send someone to a different house if you can. If you're living with someone, send them to a different house if you can, and check them. Be sure that every like 2 to 3 times a day, you check their temperature. Second, they have a temperature, that means they got sick too. But, you know, it's most important, people bought toilet paper and hand sanitizer, which is funny. Both of those things won't do much to stop the transmission of this disease. Toilet paper, every person poops the same amount. Toilet paper has been used to saying, hey, this population needs this many toilet paper rolls. So, you know, they've been producing that toilet paper rolls forever. The supply lines of toilet paper is not going to go down. Basically, what happened is everybody bought their toilet paper for April today. And so, you know, I mean, don't worry about toilet paper. Toilet paper is coming back. I guess I'll talk about the food. Most food in grocery stores expires after 2 weeks. And what happened is everybody bought this food. And, you know, the supply system is set to restock the entire grocery store in 2 weeks. But everybody bought what they would have bought in the future today. So we're not going to have food shortages here. You know, we're going to have everything restocked 2 weeks from now. Basically, everybody bought their April 1st food on March 15th. So, you know, I mean, if you have 2 weeks of food, you're good. You don't need to go out and get any more food. You're fine. Come April 1st or, you know, even a week from now, the grocery stores will be filled with stuff and you don't need to worry about food at all. Where was I? Oh, what to do when you get sick, run away. You won't be able to get tested. Don't go to the hospital, get tested. We don't have the tests, and if you are tested positive, they won't do anything different. They will just tell you to go home and stay in your place. So if you're sick, go home and stay in your place. You should only be going to the hospital if you start having breathing problems, because chances are you could have the flu and then you go to the hospital and you get something more. You get the COVID. Or, you know, you go to the hospital and you do have COVID. They're not going to admit you. I'll come back to the hospital in a second. They're basically going to say, yes, you have it, go home and stay in your room. So, you know, I mean, getting tested doesn't change much. It only matters if you are so sick that you need breathing help, if you need oxygen. that's when you should be going to the hospitals. Now, I did a post earlier this morning. I have a lot of doctor friends, and I see them post sharing the same things. We have seen what happens in Italy, in Rome. We've been trained about, pandemics and emergency medicine and how to react in this. And so there's a lot of doctors out there, all my doctor friends, they know what's coming. And what's coming is the hospitals are about to be hit with more patients than they've ever had before. Our hospitals are built to handle a very bad flu season. If we have a very bad flu season, say double the people need to go to the ICUs, that is what we are ready to be hit with. This is 10 to 20 times worse than a very bad flu season. Our hospitals are about to have 3 times the number of patients that they can actually have, that they could actually treat. And the people who are doctors who go in, they're going to be living in the hospital for 3 months. And then they're going to get sick and they're going to have to stay off for two weeks, and then they're going to have to go back. This is about to be the worst months of the life for most doctors, nurses, and people who work in healthcare. And hospitals soon are going to be making decisions on who gets to live. We only have so many ventilators. We have only so many ICU beds. And in Seattle, today or tomorrow, they're going to have to be deciding on who gets the ICU and the ventilator based on who has more life to live. This is what happens in wartime. If you have a bomb hit your base, you decide, okay, that person you could treat. That person you could treat. That person you're too far gone. We can't waste the morphine on that guy, And so that's what's going to happen in Los Angeles right now. That's what's happening in Seattle tomorrow. Tomorrow or the next day, Seattle is going to have to start rationing. They only have 7 ECMO devices. ECMOs allows basically a heart and lungs devices. Right now in Seattle, you have to be under 40 to get one of those 7 ECMO devices. They have ventilators. They haven't started rationing the ventilators, but that happens tomorrow, maybe the next day. In Los Angeles, that's 7 days away. So if you are sick, or if you have something that, appendicitis, or you have to give birth, or something like that, the hospitals are not going to be able to handle you. And, it's going to be a disaster. So that's why everything you need to do as much as you can to not get sent to the hospital. Don't drink and drive. Don't drive fast in the rain, because if you crash, you're going to get treatment that is so much less than what you should get. They won't have an ICU bed for you. You're going to have a broken arm and you're going to be just hanging out in the hallway. Right now in Seattle, they don't have enough infusion pumps. They might be drugs that you need to give over an hour. They don't have it. So they're leaving the syringes in, coming in, pushing it, coming back 30 minutes later, pushing the last bit of it. All right, let's see. All right, let's talk about the economics. So as you over the last 48 hours, a lot of stores have finally taken this seriously. Apple has closed down. Pantogia has closed down. Every store is going to close down, and people think, oh, we do this for 2 months and we'll get better. That's completely not true. This is going to be 8 to 9 to 10 to 11 months long, that what this lockdown and what the future lockdown that will happen is going to be. Because you guys have all seen that flatten the curve. It's like, okay, if everybody gets sick at one time, it goes up here, and our hospitals could only handle this. So everybody up here dies if everybody gets sick at the same time. So our goal is to flatten the curve so that everybody gets sick gradually so our hospitals can handle it and no one dies. The bad news is, okay, let's say we do that. We're at month 3, we're right here. We cannot open schools. We cannot open sports. We cannot go back to the world because suddenly you have a bunch of sick people. You open schools and everything is like, shoot up. So we will not be opening schools. We will not be having sports. If you're in school, you're done for the year. They're going to do online education because we're not going to be safe 2 months from now to open schools. We're not going to be safe 6 months from now to have NFL events or concerts. Because the second you do that, if you have 3 people who are sick at a 70,000 football game, you're going to end up with 500 people sick, and it'll explode again. So, until we have a vaccine or until we have herd immunity, once 80% of the people have had it, these things are not going to happen. And I've said this from from the start. What's up, Brian? Another Facebook Live. You always catch me. I said this on March 2nd. The stock market will not stop going down until every person has had their 2 weeks of being sick. And I fully believe that. This is not the bottom of the stock market. And it won't be the bottom of the stock market until basically every person has been sick. A lot of people have died. Then, okay, the stock market would have bottomed out. But, we'll be in a recession after that. I fully believe that this will cause a recession. We have a lot of problems with a lot of small businesses and large businesses that have made bets and taken out loans based on, hey, the economy will keep growing. And they're all about to lose those bets. So there's about to be a lot of large and small businesses that go bankrupt over these next 3 months. And, we'll see what happens. McDonald's will stay open, Mike. So, restaurants are going to have to shift to be delivery or takeout. The only restaurants that will be able to survive this and do well is if it's like, okay, we have a menu of 5 different sandwiches. You could pick your sandwich and we will hand you the sandwich at the door and you stay 1 meter away from everybody else. McDonald's could do that pretty easily. Burger King, Jack in the Box, they could do that pretty easily, whereas solely drive up. Like the drive-thru is basically the kind of model that we need for restaurants. So, watch, all restaurants will close, but drive-thrus will be open forever. So one thing that I realized is a lot of the NFL was going to have the draft in Las Vegas in April, and I started thinking about Vegas and realized that Vegas will probably cease to exist how it is, because if you go to Vegas, you're gambling. You have cards that handed you go back, go back. There's no way for that model to sustain, because that is about the worst possible thing you could do to actually transmit the disease. Everybody in a roulette, you're like, roll the dice, blow in your hands, roll the dice. Then you hand the dice to the next person. Then you hand the dice to the next person. All these chips being handed to everybody. All the cards being handed to everybody. Vegas will not be able to function. So, 8 months from now, you'll be able to get some great 5-star hotel rooms in Vegas for $20. So basically, the way I analogize this is in Europe had World War I, where the war happened spreading across Europe. Where it's like, okay, if you're in this town, the next town over, the battle is happening, and you know that it's coming to you. And you need to prepare for what happens when it's coming to you. Like in 1917, where all those people were bunkered down. And, you're just like meters away from that happening. That's what's happening right now. This war, this disease is basically a war that's spreading across the world. And people need to prepare and need to say, hey, this town did this bad. We need to do better. Right now, Italy did everything bad, and they're screwed up beyond belief. Spain, England. Oh, England is going to be so fucked. Oh, my God. They're going to be more screwed than we are. But, this, for the next 7, 8, 9 months, this disease will spread across the country. It might have a dip because it could be in summer it goes away, but, it's winter down in Australia, it's winter in South America. This disease is not going to go away because it dips. It might be fine here for a second, but, come winter for us, it'll come back up. The 1918 flu, that's what happened. They had a early bump, and then summer, and then winter, much bigger bump. Everybody died in 1919 from the 1918 flu. Once you've had it, are you immune, or can you get it again? So a lot of people think you can get infected twice. Now, there is a possibility that there is 2 viruses out there, one that's bad, one that's mild. It is possible for you to get both of those. So that is possible. But the way that you fight off this infection is by making antibodies. And if you make antibodies, you can kill this virus and the virus goes down. Those antibodies stay in your system most of the time for years. If it's only months, we're all screwed, because that means we're going to get infected over and over and over until we have a vaccine. But for the most part, if you fight off this virus, you're going to be immune until we get a vaccine. Basically, a vaccine is making you immune. So let's see. It's not like the flu shot where there's many different strains of the flu. We only have 2 that we know of. The people who were reinfected, it was probably either a bad positive the first time, like they weren't actually the first time, or maybe they got the flu, Or it could be that they started fighting off and then they had some other sickness that caused their immune system to go down and they had a relapse. It's probably not the same virus over and over. Can it mutate, and can you get it more than once? It can mutate. I'm not worried about it mutating because, I am worried now that I thought about it. It could infect some kid who has some other different virus. It can mutate, but I wouldn't worry about it. Is it okay to order food delivery? Food delivery is about as safe as you could get. It's not okay to, if you go to a restaurant, you're going to have people chopping it up and then putting it on a plate, and then your waitresses will hand it on the plate. The utensils will be washed and cleaned, versus if you have delivery, it's just made once and handed to you. That's the safest method of getting food. What is the end game for current social distant measures? We will have our current social distancing measures in place until we get a vaccine. I believe October, December. If everybody gets infected, okay, everybody's infected October, December, maybe we could get rid of it. But, when people say, I saw this in 30 Rock. I forget the exact quote from 30 Rock, but they always say a show is delayed 30 minutes because 30 minutes is the longest you could tell someone it will be delayed before someone gets mad. Everybody's saying everything is closed for 2 weeks because that's about the longest you could tell people stuff will be closed without them getting mad. Everything's going to be closed a lot longer than 2 weeks. Months. I graduated, I sent my nephew, he's a senior at Redlands High School. I sent him a text message on Friday saying, congratulations on graduating, you're not going back to school. Because he's not. I'm going to start teaching him stuff now. It's only a matter of time until there's mandatory closing of every single business. If you're a dance studio, you have 2 more weeks, maybe. If you're a law office, that's not essential, 2 weeks. It's coming. It's only what's stopping it happening right now is isn't enough political cover for like the governor to mandate it or the mayor to mandate it. They're political animals, and if they do it now, though, people get mad at them. Once Seattle starts having everybody die, the governor could say, okay, look at Seattle, we need to do this so we're not Seattle. Mayor could do that. It needs to be mandates. It needs to be mandates right now. They're using antivirals against it. Is there a chance that they can mutate the virus into new strains? I just think we won't see new strains coming. It's possible this virus could mutate. But here's the thing. This is the common cold virus. We've never had the common cold virus infect everybody this badly before. We've had the flu. We've had typhus. We've had plenty of other diseases that killed a bunch of people. This is the first time that the common flu has killed a bunch of people. So, it's scary in some ways, but also, we don't know what's happening until it's happened. This is my last question on here, so you guys start asking questions on there, and I'll get to those. Big question. Where do you see America 1 year from now? So this will change America. Things will not happen the way it happens before. People won't want to go to sporting events and concerts like they used to. Music festivals will die down. It might be years before people get this shock out of their head. It's kind of like a lot of millennials, their entire economic basis is from the 2008 crash. And all of their social views is based on, hey, what was the world like then? And that's all they knew. And so for years, we're going to have people who's like, I don't want to go to football games. I don't want to go to soccer games because I saw people die. My aunt died because of this. And so large-scale venues are going to be screwed. That's why it's like Vegas is screwed beyond belief. Stan Kroenke is going to lose billions upon billions upon billions. A lot of these sports will be more TV sports now. I am in fear of a statewide quarantine. I envisage riots for food and mass looting. We need Gavin Newsom to cool it. He wants to shut down bars already. I am nervous. That is the exact wrong belief. We need to shut everything down. We need to shut everything down now. If there's looters, shoot them. I don't care. I don't think we'll have looting because we have enough food, but, that's what we need to do. It's just, if you have a doctor visit planned or if you have a non-emergent surgery, you should cancel it. If you're getting your knee replaced, cancel it. If you're getting, if you need to, I don't know what other non-emergent things are. Here's part of the reason you want to cancel it. One, let's say you get your knee replaced and you're there at the hospital for a week. You're at a high risk of catching the disease while you're in the hospital. because there's a lot of other people who will be in the hospital who has a disease. So, if you're not sick, don't go to a hospital. It's such a bad idea that, you're likely to get it. You're likely to get the disease if you go to the hospital, and everybody at the hospital has it. Reports are China starting to go back to business after normal. So Gabe is asking how come China is different than the U.S. That was my first things. In China, they've actually done great things. In South Korea, they have body temperature scanners in public. And if you happen to have a fever, they will pull you out of the public. And so, those are the kind of things we need to do. Is it going to affect the grassroots most economy-wise, those who rely on their jobs working in service industries? I wonder what resources we could give them while we're closing everything. I don't know what's going to happen to all the workers. If this was a Democrat president and Congress, it's like, okay, we're going to borrow money, we're going to pay everybody. I don't know what Trump's going to do. I have no idea. I don't think he knows. Let's see. How do they test the vaccines? Double-blind and tracking for 6 months to see if it worked. Can they shorten that to 3 months? And will Denny's finally give us a drive-through? So the main thing about vaccines is there's a couple of different stages. I might mess this up because it's been a while since I've tested it. If you have something that you think would work as a vaccine, there are plenty of things that we could say, hey, these are 50 things we think might work as a vaccine. The first thing you need to do is find healthy volunteers to inject them into to be sure that it's not dangerous. There are plenty of things that we thought were vaccines. It's like, hey, here's a protein thing that we think will be a vaccine, and we inject them into people and it causes anaphylactic shock. So that is the first thing that we need to do. We need to be sure that, hey, there's plenty of different possible vaccines for the coronavirus, but we need to be sure that we're not about to kill everybody. Once you eliminate those, say you get started with 50, once you eliminate those 15 things that are dangerous, then you move to the 35 things that you need to figure out if it works. So you inject them to people who might get sick, and you track them and say, hey, 2 months in, these people are 50% less sick than these people, and that's when it's like, okay, now you might have something. At a minimum, that is 7 months off. Let's say, best case scenario, we find something in 7 months that prevents it. We have to ramp it up. We have to get 30 million doses out there. And that's another 5 months. So, we're not going to have a vaccine until January. At the earliest, that is when we will have a vaccine. Let's see. For parents and grandparents, the CDC doctor says, once they have symptoms and a fever of 104 taken to the hospital, your thoughts? No. You don't take... The hospitals cannot handle this many people, and they will turn you right away. Or you'll get infected with something else there. Right now we could handle people with 104 going to the hospital for a second. A week from now we can't. So the only people who are going to be able to go to the hospital are the people who need something from the hospital. If they need oxygen, if they need to be intubated. Everybody else, you're going to have to be sick at home. Sean and Lauren just got engaged. When is it safe for them to have their 500-person wedding? Next year? They could go to Wuhan. It's safe in Wuhan. But next year. People will totally eat themselves in oblivion with being home and nothing to do. Yep. Regular doctor checkup appointment. I would cancel. Carol, if I had a dentist appointment or doctor's appointment, I would cancel. Because, you look at those people and you're going to have people coming in, there's such a high probability of getting a disease in places where people cycle through that I wouldn't go to it, especially a dental appointment. No one should go to the dentist for a year. So you're going to hear a lot of reports of these miracle drugs for the coronavirus. Don't believe a single one of them. Almost every single one of them might be someone who's trying to get money for their company, or it could be a lie. Don't believe a single one of these reports that, hey, they found a miracle cure for this, because they won't. Don't get me wrong. There might be some anti-cancer, anti-HIV drug, something like that is effective, and we'll find out randomly 4 months from now. But, if right now you will not see anything that is accurate for the next couple of months on whether or not, hey, we found something that could change courses. So every time you see it, don't. And if you see someone posting something, hey, I have a friend at Stanford Medical and they said blah, 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 like hold in your breath. That's all bullshit. There's something going around. If you hold in your breath for 15 seconds and you don't do that, you don't have the virus. That is a complete lie. Let's see. I don't know. Tom Brady, I'd take him if he's 25 million or less. I wouldn't take him for 30 million. Okay. Okay, I think I've covered almost everything. I'm going to hold it open for another 30 seconds if anybody else has a question. I've covered everything that I thought I wanted to cover. Next video. Oh. So someone recommended this. So someone said they'd take me a lot more serious if I was wearing a white coat. So I had to go up in my attic, and I found my white coat. This is my white coat. This is the first time I put on a white coat in 5 years. Okay, 5 years. See, I'm a doctor. There you go. I am a doctor. I have not put on this white coat since the day I graduated fellowship at Cedars. That was the last time I wore a white coat. If your family members are infected and you've been with them for the last 3 days, you are infected. You know, China has pretty good evidence that, because these people are infectious for 5 days before they actually show symptoms. So the Utah Jazz player, there's a Utah Jazz player who was sick. He touched all the microphones. He played games. And it turns out he had COVID. And he infected a player who was guarding him. And that player who was guarding him played in 2 more games. So 3 days after that player who was guarding him was infected, he put up 33 points. He was infectious at that moment of time. If an NBA player could play and put up 33 points, a lot of people are not going to know they're sick. So if your family member is sick, you are probably sick. Chances are. And so, just treat yourself as being sick. I believe supermarkets are safe just because of how they're built and structured. I'm not worried about supermarkets at all. You just have to stand apart from each other and use Apple Pay. That keypad is going to be a germ thing, but I'm not overly worried about supermarkets. Let's see. Donald Trump. I don't know about Donald Trump. Okay. Do you expect a big resurgence in China when I don't know. I have no idea what's going to happen in China. Love this. Next time, give me some healthy tips for eating and enhancement of the... So obesity has been shown to be a very negative predictor for this disease. Old age and obesity and asthma/smoking/cystic fibrosis. Those are the 3 things, not in that order. Old age, asthma, stuff like that, obesity have been shown to be the 3 biggest negative prognostic factors on whether or not this will have bad problems. There's one Charger fan who is says this is all a hoax. This is all a, lie. She posts nonstop about how this is a hoax. She has cystic fibrosis, and if she catches, I don't think she'll make it. What about my son with heart disease? He had pulmonary stenosis. I wouldn't worry, Brianna. I don't see anything in that diagnosis that would make it more likely to have your son do something. First time, Jackie's never seen me in a white coat. Where are you, Jackie? This is the first time my wife has ever seen me in a white coat. That is the funniest crap ever. All right. At this point, it's safe to say we are going to get sick. Do we treat it as a flu, NyQuil, you said, ibuprofen? I think 50 to 60 to 70% of the Americans will get sick. It's not guaranteed you'll get sick. So, if you don't take measures, you're guaranteed to get sick, and you're guaranteed to get everybody else sick. If you do take measures, there's a good chance that you and your family won't get sick. So, I'm trying to isolate my parents as much as possible. And, I'm going to have strict rules that if you come to my house, you have to go immediately and wash your hands. And I'm not going to allow anybody into my house who's not my family. I suggest everybody else does the same. And, I'm going to have my parents cancel their church. They're not going to church again. They're not having their small group again. They're not going to have anybody who they don't know whose family who can see them. I wouldn't worry about kids with asthma. For some reason, this does not affect kids in any way, shape, or form. China had 1 person die of the 60,000 who was under 20. There's basically if you're under 50, you're not going to die, probably. We'll see. China handled this much better than everybody else. In Italy, they're having 40-year-olds die, and that's probably what will happen here. I wouldn't worry about a kid with asthma because he's a kid. Literally, this doesn't affect kids. Most kids don't even know they have it. There's a South Korean couple. The husband got it. Then 2 days later, the wife got it, and they had a 6-month-old baby, and so they put him in isolation. And they checked he had one temperature for 1 hour of 100.4, but he was wildly infectious the entire time. So I washed my hands. Sadly, yes, you should not visit your mom in the nursing home. And that was one of the things that Newsom said, that he is asking people not to visit people in the hospital. You should not visit anybody in the hospital. I think it should be a mandate that because in Seattle, one person got sick in the nursery home, and 17 of the 40 patients are dead right now. The rest of them have the virus, and they're all going to die. So, if you're in the nursing home, you want that nursing home shut down so that no one can visit it. Let's see. Is toilet paper helpful? Yes. Helps your butt. Let's see. Oh, an interesting thing from the governor's news conference yesterday, they're talking about buying closed down hospitals. We need to reopen County Hospital. We need to reopen Temple Hospital. There are hospitals out there that were shut down for seismic reasons that we need to reopen. The VA has all these buildings that were shut down for seismic hospitals. He says that the state is in process of buying these hospitals and they will reopen, which is what we need to do. Let's see. Now, a smart thing to do if you're a hotel, talk to a local hospital. See if they could if they will rent out your rooms to be a fever clinic, like I was talking about China doing. Have the not so sick people stay in your thing and just say, hey, you can stay here. Basically try to turn your hotel into a COVID isolation center, because it's a great place for if you're sick but you're not overly sick. So that's what I do if I owned a small hotel. Let's see. I currently work at residential care facility for the elderly. What precautions can we take? Brianna, you need to ban all visitors. No one can visit. Have them visit from the outside windows if possible, but no one can visit. Someone's asking if you have a sore throat, is apple cider vinegar for it? I don't know. It doesn't change the disease, but you might feel better. No idea. Ivan, if you have sex the first time, that would be great. Are laundromats safe? If you could bring in your own soap and you are careful that you clean off the washer when you actually open it and close it, yeah, it's safer than... I'm not worried about your clothes being infected. I'm worried about the stuff you touch in the laundromat. Someone asked if laundromats are safe. So let's see. Thank you so much. Okay, I'm going to call it there. I'll do this again in a couple of days. All right, if you guys have any questions, I'm going to do another thing where I know the next time I'm going to post it, I'll post it up and I'll answer the questions that time.